friends, this is Garima Kuswa, first year professional medical student at GMC Betia, and in this video I would be talking about bleeding time and clotting time and the questions related on this topic which are very important for your Viva exams. So let's get started. So our first question is, what do you understand by the term homeostasis? Spontaneous arrest or prevention of bleeding by physiological process is called homeostasis. How does the bleeding get arrested, or enumerate the series of events involved in homeostasis? Three major events which get involved during arrest of bleeding are constriction of injured blood vessel due to release of 5-hydroxytryptamine from the damaged platelets, which is also called serotonin, formation of a homeostatic plug of platelets, seal of damaged blood vessel by the blood clot. How is the coagulation of blood brought about? The clotting mechanism responsible for formation of fibrin involves a complex of damaged blood vessels by the blood clot. How is the coagulation of blood brought about? The clotting mechanism responsible for formation of fibrin involves a complex series cascade of reactions. Here, inactive enzymes are activated, which in turn activate other inactive enzymes. The ultimate step is the conversion of prothrombin to thrombin, an enzyme by a substance thromboplastin. Thrombin then converts fibrinogen into fibrin. Name the clotting mechanism by which the clotting of blood is brought about in the capillary gas tube mechanism. The clotting mechanism involves is the intrinsic system pathway, since it is brought by exposing the blood to electronegatively charged wettable surface glass. Name the factors on which BT and CT depends. Bleeding time and clotting time depends. Factors on which BT depends are conditions of the vessel wall, formation of temporary homeostatic plug, temperature. Factors on which clotting time depends are presence of all clotting factors and temperature. Is clotting time longer than that of the bleeding time in a normal individual? Clotting mechanism involves a complex cascade of reactions which are time consuming. So clotting time is greater than that of the bleeding time. Name the conditions where bleeding and clotting time are altered. Bleeding time gets prolonged when there is decreased platelet count, as in thrombocytopenia purpura. Thrombocytopenic purpura. Abnormally weakness in the walls of the capillary, as in purpura hemorrhagica. When temperature increases, it delays the contraction of blood vessels. Conversely, bleeding time decreases with decrease in temperature. Clotting time gets prolonged when there is deficiency of clotting factors, hemophilia being the most common condition seen, which is due to deficiency of factor 8. Vitamin K deficiency, it is required for the synthesis of prothrombin, factor 2 and factor 7, 9 and 10 in the liver. 2, 7, 9, 10 require vitamin K. Define purpura. Purpura is a condition with various manifestations and different causes, characterized by capillary abnormality resulting in hemorrhage into the skin, mucous membrane, internal organs and other tissues. What happens to bleeding time and clotting time in hemophilia and purpura? In purpura, bleeding time increases to 10 to 20 minutes or more than, whereas clotting time is normal. In hemophilia, clotting time increases markedly, whereas the bleeding time is normal. Calcium play an important role in many stages of cascade reaction during clotting mechanism. However, calcium deficiency do not produce coagulation disorder. Explain. This is because the traces of calcium are required for coagulation. Even if very severe calcium deficiency occurs, it may produce other symptoms like tetany before coagulation disorder develops. What is the clinical significance of determining bleeding time and clotting time? It is very important to know bleeding time and clotting time in following conditions: before surgery, before any biopsy, especially liver or bone marrow biopsy, and before putting any patient on anticoagulant therapy. Ideally, prothrombin time should be assessed. Name one method each for bleeding time and clotting time which are not commercially in use. For determining bleeding time, Ivy's method, and for clotting time, Lee's and White method. What is a thrombocytopenic purpura and thromboasthenic purpura? Purpura which normal platelet count is a thrombocytopenic purpura, while in thromboasthenic purpura there are abnormal circulating platelets but platelet count is normal. What is hemophilia? It is inherited sex-linked anomaly due to an abnormal gene on X chromosome. It is characterized by abnormality or deficiency of factor VIII. Give the physiological importance of coagulation. The physiological significance of coagulation is obvious from the following effects: prevention of further blood loss by sealing an injury, drawing together of wound edges by shrinkage of the clot, protection against injury and drying by scab formation, provision of a framework for tissue repair. Coagulation is thus the initial step in the repair of tissue injury. Give common causes of bleeding disorder. These can be grouped as defective bleed clot due to deficiency of clotting factors 1, 2, 5, 8, 9 and 10. Vitamin K deficiency, anticoagulant overdose. Defective capillary contractility, purpura, combined defects. Name some tests to assess bleeding disorder. Bleeding time, clotting time, platelet count, prothrombin time normal 11 to 16 seconds, clot retraction time, thromboplastin, prothrombin activator, generation type, skin microscopy, determination of capillary resistance or fragility. Describe which test is used to monitor oral anticoagulant therapy. Prothrombin time, easy and sensitive. It assesses extrinsic coagulation system. It is increased in vitamin K deficiency and liver disease. What is prothrombin time? How is it done? Give its physiological significance. It involves measuring of clotting time of plasma after the addition of brain extract containing tissue thromboplastin. In this, the intrinsic system of initiation of coagulation is not involved, as the plasma does not contain platelets. It is more sensitive to changes in factors 5, 7, 10 and fibrinogen content. Thank you. All the best, and if you like this overall questions, you can subscribe to my channel so that I would be influenced by your likes and I would make more videos. Thank you.